coronavirus has infected maximum of 10% of world population, WHO expert warns. If that number is anywhere close to real, then India is vastly underestimating their level. Okay, this is where we start dumping everything into making a cure Plague Inc. style right. And as it appears that there is a second wave going through Europe now, and the US is a bunch of states with open borders and different quarantine standards, I will be working from home for a while. Only 70% before it gets the total organ failure and necrosis. Not sure I get this. There's 7 billion people and there's only 34 million cases. Are they saying there's really 700 million cases? As the virus mutates and evolves, is it likely to become less deadly? The Spanish flu after the First World War, as deadly as it was at the time, eventually became the regular seasonal flu. Is this more because we are the descendants of the survivors and have inherited some genetic immunity? Or that the virus became less deadly due to evolutionary pressures, such as the mutations that spread without killing can persist longer than those that kill the host before being able to rapidly spread? Only 90% to go. Isn't this a starting choice in Stellaris? How can you know the maximum? Hardly a shred of optimism in these comments. Yeah, great, and now they are telling us we can get it again. Fuck this, I did my 4 weeks sick and feel like shit from it. Fuck this so much. So that means best case scenario, the death rate is roughly 128%. Someone correct me if my math is wrong. 10% of 7.8 billion is 780 million and there's been 1 million deaths. I know a lot of people are really invested in these numbers, but look through this comment section and see how carelessly all these stats are thrown around, not just by Redditors but by media as well. No one knows WTF they are talking about, same as back in January. I get that speculation is natural, but Jesus, in an era where every snippet of information is weaponized, maybe we don't need the play-by-play. We're still sitting at don't breathe other people's coughs and everything else is jade egg confirmation seeking bullshit. If we went from 1%-10% in 6 months, where will we be after 12? And it's only year 1. The Spanish flu didn't really get killing till year 2. What does that make the fatality rate then? What is the highest percentage of the world has ever been infected with something before? I bet it's way more. I just gave blood and they said I had the antibodies and I had 0 symptoms, never got sick. I'm sure this is the case for the majority. So, and correct me if I'm wrong, isn't this great news? Like really great news? Because if 10% of the world has been infected, that means COVID-19 has a case fatality rate of 0. https://www. BBC. Co. UK/sounds/play/p03kpvk2. I quoted the Big Short on this post and that stat is probably exaggerated, but there is without a doubt a link between unemployment and increased mortality. That might be an increase in heart attacks/strokes or other health issues in a country like the US. That might be malnourishment and other illnesses in countries like India. So the choice we as humanity are faced with: A. We could continue with rigorous measures taking into account that this will continue to have economic impacts, high unemployment into 2021, or B. Weaken measures and see a rise in infections and deaths. Either way, this isn't going to end well. Yeah, but that's just because they hit max number of rows in Excel. Well, at this rate there is no way the virus can get to Madagascar and kill everyone. I guess you have to restart 2020. So my math of this lasting 6 years, https://www. reddit.com/r/askwaranavirus/can_someone_please_check_my_math_on_how_long_this, wasn't too far off. And I did those numbers based on the transmission rates 5 months ago. We're at 10% exposure, meaning 10% of the world's population is immune, fighting the virus and on the road towards immunity, or has passed. We need to be at 60 to 70% immunity either through vaccination or exposure to the virus for herd immunity to take effect. Herd immunity naturally slows the spread of the virus without masks or distancing, meaning life can get back to normal. It's taken 10 months to get to 10%, so napkin math again, 3 to 5 years until we get to 70%. Right now our only tool is distancing and mask wearing. The medical community has learned how to treat patients a lot better. So hospitalization deaths are down. And for the most part we've been able to prevent the healthcare system from falling apart and overwhelming its cases, but our nurses, doctors, and EMS crews have been overworked on the front lines of this war. And I don't want to underappreciate everything they've been doing. Back to the main point. A vaccine will drastically speed up the rate we can safely get people immune to the virus, but it currently looks like vaccination will realistically take 2 years to reach the whole world. We don't have anywhere near enough sterile glass bottles in existence just to store the vaccines in. If the vaccine needs to be kept at -80 degrees, that makes transporting and distributing the vaccine exponentially harder, especially in parts of the world that don't have access to refrigeration. The vaccines may require a booster shot, which increases the complexity of administrating it to the world. There's also going to be some contention regarding who gets the vaccine first. In my opinion, it should absolutely go towards hospital staff, retirement home staff, and first responders before anyone else. Then they can worry less about getting sick themselves or getting their patients sick. Then towards at-risk groups like those over 65 and people with compromised immune systems. Then to essential employees who are working at places deemed essential that were open throughout the lockdowns. And then towards the general population. I've been following MedCram on YouTube, https://www.youtube.com/watch v = RKO2XGMPN04, throughout this pandemic. I'll try to edit in some links. I think this video, https://www.youtube.com/watch v = J_8CI New York QAVI, is where I got a good chunk of my information on vaccine deployment, but I know there was one more video that focused on deployment. I have a degree in biology and focused on arbovirology in school. So I'm not an expert, get it, ha face with rolling eyes, but I did study viral transmission in school and I've been trying to follow what the experts and people on the front lines have been saying. CDC COVID-19 survival rates. *Age 0 to 1999. 997%. *Age 20 to 49, 99. 98%. Age 50 to 69, 99. 5%. Age 70 plus, 94. That number is likely false. China, Russia, and India are greatly underreporting, as are many Asian countries. Also, wouldn't believe all numbers coming from African and South American countries, as much of the rural poor population likely isn't getting tested regularly enough to be accurate. Plus, this was likely around months earlier than first reported cases in North America and Europe, so those never got counted.